Welcome back to Adversary to Ally.
It's time we talked about domestic violence and how it's affecting our lives. The cost is much too high. Let's stop it from destroying our lives. Adversary to ally. Adversary to ally.
How many mothers would cry? How many children would die?
Commodity, the golden queen. But you got to do more than talk. You got to listen.
Hello, everyone. I'm James Walker, and thank you so much for joining us again this week. For those of you who are new to this show, this is the podcast that talks with other men about domestic violence and child abuse and how we as men can help control the atmosphere or at least lower the temperature. So many women and children are being beaten and killed that something simply has to be done. My guest this week is a psychiatrist. As anyone knows, domestic violence and child abuse, anyone raised in that situation, anyone who is experiencing violence on any level, it leaves a lot of trauma. And he's here to talk to us today about the complications of trauma and what we can do about it.
I'm Charles Morgan. I'm a psychiatrist, and I now have a private practice in Ridgefield, Connecticut. But prior to that, I have been chairman of the Department of Psychiatry at Bridgeport Hospital, which I did for 20 years. That involved overseeing the department, but in addition, doing clinical work in basically all the different areas, from outpatient to inpatient, the emergency room, and intensive outpatient program. So I've actually kind of seen all the breadth of treatment that we offer. Bridgeport Hospital is part of the Yale system, and so supervise trainees that go through the program as well.
Now, when you say you deal with trauma, what kind of trauma are we talking about? We talk about physical trauma, or we're talking about mental health, that type of trauma?
So I'm a psychiatrist by training. So I deal with post-traumatic stress disorder or trauma as a result of whether it's violence, exposure to natural disasters, basically, I keep thinking that nobody goes through this life without experiencing some kind of trauma. For some people, it's actually much more of a major part of their life. And so when you ask me about domestic violence, my first thought was, as much as we don't see patients directly, for the most part, as a psychiatrist, not that we might not have missed it because it's usually underreported, but what we tend to see are the hidden costs of domestic violence.
And actually, I'm glad you do, because that's actually what I want to talk to you about. Because, you know, when you're talking about domestic violence, and trust me, I know this because I come from that situation, which is why this is so important to me. And the reason why I want to talk with men about it, because men are the primary abusers. Women abuse also, but it's mostly men. And I find that there's really nothing out here for men where they can talk about this, discuss ways where we might be able to help each other work through certain things. So what do you see when people come to you and they are suffering from PTSD? First of all, is there a difference between men and women and how they cope with it?
So trauma, for the most part, affects different people differently. So that you may find people who grow up in the same circumstances may not have symptoms of trauma, whereas others might. But there are some broad categories in terms of how trauma presents itself. One big way is avoidance of situations that may bring up the trauma. Another part is what I would call reactivity, where the person becomes triggered by or aroused by certain situations. And then the third part of trauma is reliving the event. So those are kind of the three big areas: avoidance, arousal and reactivity, and reliving the event. Those are kind of the three big areas when we think about trauma.
And when you say reliving, I'm wondering if you're talking about mentally just being frozen in that space and time when those bad things were happening, and you, even though you're growing and so forth and so on, you kind of keep reliving the experiences that you had as, say, as in my particular case, as a child.
So reliving could take the forms of nightmares. It could be one of the things that we have learned, I say, over the last 20 years, more so than when I was in training, is how trauma resides in the body. And there's a book out that's called The Body Keeps the Score that really describes that as much as psychiatrists, we're taught to, help people talk about their experiences. What we really need to shift to is having people engage in somatic therapies that involve the body, because a big part of what happens to trauma is that it gets stored. Our brains, if you want to think about it in a very simplistic way, we have what's called a reptilian part of the brain. That's the part that gives us the basic function of breathing, heart rate, crying when an infant is born. The larger part of the brain, the one that we tend to focus on, is our prefrontal cortex. It's the part that allows us to think and make decisions. In trauma, the body is experiencing something that's life-threatening. And so the part of the body that becomes engaged is that small part, what we call, sometimes you hear it referred to as the lizard brain or the reptilian brain. It's a small part of the brain, but controls a lot of function, and that's where that's stored. And so the whole idea of fight or flight or freeze to protect. So for someone who's exposed to trauma, for example, you might have to pretend that you're dead. And that's a freeze motion. Or you may have to fight if you think you're big enough to take on the person who's abusing you. Or you may have to run away. Now, that gets stored within us. And now there's actually even evidence that we're able to pass that on intergenerationally. So that trauma is, if you think about it, is living in the past or having the past intrude on the present. Right. So you're not able to differentiate, is this a real threat that's happening right now, or is it something coming from the past? And so you might find stuff like increased heart rate or shortness of breath. The muscles are getting ready, you're tensed up because of the presence of somebody who might walk into the room. And that may be due to a memory that's stirred up from a traumatic event, or a smell may evoke that kind of a response. And so that's the type of stuff that domestic violence can have. And there actually enough evidence now that whether you're the victim of domestic violence or you've observed it, if you look at certain brain scans, the same parts of the brain are lighting up. So you can be traumatized by witnessing domestic violence as much as you could be the direct victim of domestic violence.
Now, when trauma happens to children,
Mm-hmm.
and they experience violence or they see constant violence, how does that affect their mental health as they grow up?
So there are a number of areas. There's a scale called the ACEs, the Adverse Childhood Event Scale, that looks at different traumatic events that can affect children. And on that scale, if you hit 3 of the things, and that could be physical violence, emotional violence, it could be separation, death of a parent, any of those traumatic events that occur, if you hit 4, your risk of developing several medical problems, whether it's high blood pressure, diabetes, alcoholism, drug addiction increase, but also the risk of other mental health issues increase. The other issue is that there is some learned behavior in seeing violence, so that the kids grow up to then reenact those behaviors. They've not figured out how to negotiate with other people without the use of violence. And so some of it is learned behavior, but some of that is also the triggers that, in fact, there are children who've been exposed early enough that they have no real recollection of the events, but you see them suffering from issues of anxiety, depression, acting out behaviors related to their early exposure to domestic violence.
When when children witness this, and is there like a time period that you have to get to them to treat them where they can more or less kind of cope with this or get over it? Or I guess what I'm really asking is, if you do not treat children and help them, what are the consequences of them witnessing that constantly and growing up without any type of mental health service?
So again, it is individual, that because, as I said earlier, even people born in the same circumstances, exposed to the same situation, depend on how they're wired, may or may not have symptoms of trauma. So every exposure doesn't necessarily cause a certain reaction. One of the ways that I try to think about this is, when you train in medicine, as you go through medical school, you go through all the different rotations. So even though I'm a psychiatrist, I've had exposure to the different areas. And one of the things that I still remember from my days of pediatrics rotation is that we would do what we called well baby exams. So after babies were born, the next day, the team would go in to evaluate. And you'd all go through the same exercises. They'd hold the baby in the palm of their hand, pretend to drop the baby a little bit to check if the arms extend equally, because they're looking for any kind of neurologic damage. They would, make a snapping sound at their ear to make sure that they could hear. They'd shine a light. When you do that, and you'd see some babies would just scream as if the world were ending. Others are like, oh, there's a light over here. I want to look at that. What's that sound? You could just see the differences in the behavior. So you become wired differently. So, and that may be protective in certain ways. The other thing, so we call that resilience, the ability to withstand some of those pressures. The other thing is that even though you may be exposed, there may be other people in your life who comfort you, protect you, and ameliorate some of those difficulties. And then there are those, unfortunately, who don't have that and can develop more serious consequences, so that you see repetition of the same behaviors. You see it in depression. You can see it in anxiety disorders, and post-traumatic stress disorder, or the trauma response, is part of that anxiety disorder. So you could see that as well. You asked the question, is there a particular time to intervene? I don't know if there's a particular time, but I know that the earlier we intervene, the better you can do that. So one of the things that I now do part-time is that I just actually was part of an organization called Salbona that's looking at providing creative therapies to children to help with building resiliency. And if they've been exposed to trauma, to help them manage some of that stuff. And you're not going directly at asking, have you experienced trauma? What you're doing is you're giving them a project to work on. It's an art project, or it's music, or something that involves their bodies. That will help them go through the pain that they've experienced and express it in a way that makes what we call clean pain. So you experience it without it becoming what some people call dirty pain, and continue the cycle of violence.
So in other words, you give them you give them a project that they want to be involved in, that they like to be involved in, and in doing so, you ask them questions during that time, or that leads them to are they more free to talk? Is that it, that they don't feel like they're under the gun, so to speak, with someone just asking them directly? Or is it like kind of like a dog who doesn't like to get his nails clipped, but if you put peanut butter on your head or something, and he starts licking that, he just forgets all about you trimming his toenail.
It's actually more engaging the brain in a way, because when you talk about stuff, you bring up the feelings, but there's no way to put it. If you have music that you can play or art that you can do, you're engaging the brain in putting that stuff out. And then you can have a conversation with them. You colored that stuff, whatever that is. What does it mean to you? And so red for somebody might mean anger, another person might mean joy. But you allow them to tell you what it is that they have created. So that's one thing. The other thing that we find is that most of our, as I mentioned before, trauma is held in the body. And if we can teach people how to pay attention to their breathing, to their breath, that will actually help to ground them, but also help to relax when they're starting to get triggered by stuff. So so you can incorporate that into play activities, for example. So with children, it may be pretend that you are going to blow up a balloon. So you take a deep breath in and now try blowing it out as if you're blowing through a straw. And you do that for a number of times. That will start to slow your heartbeat down, start to slow make your focus better, so that you now start to engage that prefrontal cortex that we talked about, the part that helps you make decisions and not impulsive and reactive.
Do triggers ever go away? Or do you just
it's not so much that the triggers go away, that you may learn to respond differently to the triggers. So say you were beaten up by a tall Black man, for example. You see one walk into the store, your body might start to react as if you were the 4-year-old boy. But you start to breathe, this is a different person. You can then come back into the present time. Because like I said, if you think about trauma, is the past intruding on the present. You're not able to enjoy the present because the past is intruding.
But sometimes those things that happen in the past are really, they really, how can I say, they really have a grip on you, and it is very difficult to get away from it. I know, because again, it took me, and I'm ashamed to say it now, but it took me till I was near 50 to come to terms with what happened to me as a child. And
so, you said shame, but actually I see that as so much courage, because for a number of reasons. One, as males, and especially as Black males, we're not encouraged to deal with feelings. No. It's actually, you're supposed to suppress. The second is that there is so much stigma attached to seeking care, and especially again for Black males, that whatever age you get to do it, it's a celebration, because that generally does not happen. And so I'm really glad that you're saying, I want to talk to men about this, because when I look at my practice, for example, my private practice, there are very few men and there are very few Black men.
I was going to ask you that. Okay.
So the fact that you have this forum, I think, is one way to break down the barriers. This is a conversation you can have in a barbershop, while you're having drinks with your friends. You won't necessarily make it into a psychiatrist's office, because that is for crazy people. It's how we tend to see it.
Yes, I know. And what I find very strange is when I talk to Black men individually, not as a group, but individually, and I talk about domestic violence, I tell them how it really affected me, and how it not only took a long time, but how I came to grips with it. I don't think I'll ever get over it, but I've learned to live with it. And more than that, I've learned that I don't have to be defined by it.
Yeah.
My brother, on the other hand, he was determined. He said, our mother worked too hard to get us out. He said, and I just refuse to be traumatized. After everything that she did, I refuse to be traumatized by my past. So we've taken two different
paths.
And my sisters too. I have 5 sisters, and we do talk about this quite frequently because of our childhood. And one of the things that I was very complimented, she said to me, "I cannot believe how gentle you are." She says, "I remember, because I was the kid that got I was the target. I was the one that got the beat. I was the main target. I was the one that got beat. I was the one, and she says, I just can't believe how sensitive you are and how gentle you are. But on the other hand, doctor, that's not absolutely true. Sometimes rage is in me, and I mean rage that I find sometimes that I have to literally just be by myself because I'm afraid of the rage and the anger in me. And I've never known, is that because, am I afraid to just, face that? Or am I afraid that I'm going to turn into my father? And, so, I mean, it's a very strange path that people take. One of the things that when I talk to these men, they agree. And when I asked them, I said, well, have you sought help? Nah, I'm not this and that. I'm not going to do that. But they agreed that they should.
Yeah. I think we just have to find the right forum for that. I think for too long we have divided physical and mental health. So, most men will still go in for physical. We still avoid our prostate exams and colonoscopies.
Yes, we do.
But it's on a schedule. And I think if our healthcare system was set up differently so that men could have more time to talk to their primary care physicians about some of those things, we could be making some progress. What you're doing to me, is just amazing because it's thinking outside of the box to have this place where men may be listening in and can identify, and to then start to learn what are some of the self-care activities that I can take part in. And so, one of the things that we teach people, I remember I talked about the breathing before, and there's certain breathing exercises people can do. But there are other activities of mindfulness, staying in the present, so that when that rage comes up, for example, knowing that you can go for a walk outside and listen to whether it's the birds or a stream running by, or being barefooted and feeling the ground under your feet. That's important way to deal. When the thoughts come into your head about the past, to realize that's just a thought, it doesn't define me, and to move on to another activity that may be relaxing. The use of music, for example, because again, music is pre-verbal. We hear music before we can learn to talk. So that's another way that you can do that. So exposing people to music therapy, what kind of music, and you may find, for example, certain kind of music gets you more agitated, switch to something else. Learning things like meditation, for example, can be very, very helpful. And people think meditation means you have to, empty your mind out of everything and be totally still. It could be repeating just one phrase over and over that calms you down. And if you're Christian, that could be something like Jesus. And you can just repeat that quietly over and over. If you're into more Buddhist, it could be just that you could. And actually the fact of humming, which actually I just learned recently, that one of the ways that African Americans, those of us who've been enslaved, when we couldn't participate in regular church, or where regular church was actually part of the traumatic process for us, that we had these brush arbors where people just hummed and moaned, and how that is in fact a calming sensation. So just humming, for example, not so much from the vocal cords, but coming deep from within. And so I start to think about where spirituals come in, for example. The humming and moan that go on with that, how healing I think that can be. One of the books that I'm currently reading, a group of us for an anti-racism group, is called My Grandmother's Hands. And the author talks about how trauma gets transmitted within generations, and gives these body exercises that you can use to help yourself to heal. One of them, for example, is sitting quietly for maybe 10 minutes or so, and imagine somebody that you love walking into the circle, and just feel the way your body responds to that. And for most of us, there's a kind of an openness if you have a positive memory. And then it says, go on to somebody who is neutral. It may be a coworker, somebody you interact with, that you don't have that same experience with, that closeness to, and pay attention to your body and your breathing. And then the third part is the scarier part, bringing in someone who might have been your abuser or somebody who antagonizes you, and feeling what that does to your body. And for most of us, it's a constriction of our breathing, a tightness, and pay attention to that. And then to try to then work your way out to a relaxing stage. Now, for some people who have not had severe trauma, they may be able to do this by themselves. But it's another thing that with a couple of people, a couple of guys, you could just sit and do this and do the thing, listening to somebody's voice tape, carrying you through that exercise.
You mentioned one thing I want to ask you: when let's say you are abused. Let me just get straight through it. I was raped as a kid by three different guys, and I swore if I ever saw one of them as an adult, that I would quite frankly do whatever it took for them to remember what they did to me. And yet when I saw one of them, when I was I think I was around 23, just out of the military, buff, no ifs, ands, or buts about it, could have taken him apart. I didn't. And quite frankly, Doc, that has always bothered me, that I just he was with his two little boys, and, he kind of said he was sorry. And I think the reason why I didn't, because he was with his two little boys. But I'm wondering why. I hated him for so long, and for so long he stayed right here. And when I actually saw him and was within a foot of him, I did nothing. And yet I was okay with it. But then again, I wasn't okay with it.
What was the feeling when you saw him, though? Was it still the anger was still there?
No, my feeling when I first saw him was actually kind of shocked, because I remember him as being this big, thing that was just towering over me and overpowering me. And when I saw him, he was actually smaller than me. And so forth. And I actually have a memoir that I'm self-publishing through Amazon, and that is one of the main things that affected me as a child, of being raped by these three guys over a 3-month period, and how it really affected me. So when I had my shot, I didn't take it, and I could have destroyed this guy. I know him.
Again, not knowing you, I just wonder if at that moment, the recognition was, I'm no longer powerless. And maybe that's what happened, so that the dynamic shifted. As opposed to being this victim, you are now this big, buff, powerful guy who could take him. And maybe that recognition was enough to say, not that you're at peace with it, but you've come to terms with it.
And that's the way I've kind of looked at it. I came to terms with it, but I also wondered if I was still that little boy afraid of him, even though I knew I could take him in a heartbeat. But it was just one of those things, doctor, that bothers me. And I wonder about other kids who go through trauma. And do you ever, I think I've asked you this, do you ever really get rid of it, or you just learn to live with it?
I think you come to terms with it. It's not as painful for you as you learn to manage it. And, I think a big part of what happens to people is that when they're being victimized, they think, I should have fought, I should have killed him, all of those things. And I didn't do any of that. And I think some of the behaviors that we look back and say, oh, I was too passive. I think you have to come to terms with that's what saved my life. I'm here, I'm a survivor. And I think that's the part that's missing in a lot of people, is that they continue to blame themselves for what they did or did not do at the time, or the symptoms that came afterwards, so that there are people that become abusive themselves, or they become suicidal, or they cut themselves or burn themselves.
Which, of course, is exactly what I did. I became abusive. I became suicidal. However, I won't say abusive. Let's just say that my thoughts were abusive, but not the actual.
No, the actual.
While I was a kid who went through all and I mean, very damaging. I was pretty much out of my mind. I mean, chasing my sisters up the street with knives and so forth. I was pretty gone. It took a long time for me to, but on the other hand, no drugs, no jail, nothing like that. But all that anger and all that whatever, I turned on me. And it took a long time for me to work that out. But at any rate, Doctor, I see that, oh no, we still got a few more minutes. Okay. But let me just ask you before, is there anything that I have not asked you that you think is important that, that for this podcast, for people to know?
I think one thing that I would say is that a lot of people, when they've gone through any kind of abuse, think they're alone. And there are more people who have gone through, if not the same experiences that are similar. And so realizing that it's part of the human condition and that you can heal from it is important. I think the other thing that I would say is self-forgiveness, because like I said earlier, the whole thing of I am still here is important. And many people hold on to feelings of self-hatred, low self-esteem, all of those things. And until they get to that part of self-forgiveness, and I'm not talking about forgiving the person who victimized you, because that's a whole other issue. But if you can do that, that's part of the healing process.
But the main healing process, I think what you're saying, is to forgive yourself.
Yeah.
And so forth. And quite frankly, that's the hardest part, I think, is to forgive yourself, because for years it was, I brought this on myself. Something I did made them want to rape me. It made them think that I could and I would accept it and so forth. And quite frankly, as time went on in those few months that happened, I found out that I was no longer, trying to fight them off. That I had just come to accept it. And I think as I grew older, that bothered me more than anything else. So, it's really trauma. It's really, it has a lot of branches. That's all I can say. It has a lot of branches, and it takes a lot to overcome it. And sometimes I'm not sure you ever do overcome it. I think, like you said, you come to terms with it.
And you continue to heal, but I think you're right. It's like a pebble in a pond. It affects you emotionally, physically, spiritually, mentally, all of those areas. And that's why I think a holistic approach to health is important, that you have to look at all of those things.